I just had an opportunity to table legislation with respect to medical assistance in dying, where mental illness is sole underlying cause, with a 3-year extension. It will allow in 2 years for there to be a parliamentary review to assess the state of readiness of the system at this time. I can say that I have communicated with all of my provincial counterparts. I haven't had an opportunity with my territorial counterparts on this, but their response was very favorable, as I think you'll hear. They really do feel that they need more time to be able to look at this. I will state again that the question at issue here is a question of readiness. We accept equivalency in the suffering of mental suffering and physical suffering. And of course, here we're talking about mental illness. That shouldn't be conflated with mental health concerns. But I will lastly say that the time that we have to adopt this is limited. We certainly are having conversations, Minister Varani and I, with our opposition counterparts, because we have a looming date in March by which we have to get this done in limited sitting days. So the problem is that you have the curriculum, you have the materials that people have to get trained by, and in order for the system to do that training and to get people ready to make sure that the right decisions are made. Again, what we're talking about here, and it's an important distinction, we're talking about people with intractable mental illness circumstances who have been suffering and tried absolutely everything, and that they get to the end of that journey and they on their own recognizance make a decision that they've tried everything and that they want to access MAiD. What we want to make sure is that the system is trained to that standard, that the curriculums are adopted, and that the systems have fully metabolized what the intention is. And what we heard, what I specifically heard from my health counterparts in provinces and territories, is in order to get to that state, they were going to need a significant amount of time. But what I would say is every single province, every territory said they're not ready. CAMH said they're not ready. The Canadian Mental Health Association said they're not ready. So I appreciate that that there are some people who feel that we're ready, but when those that are going to be delivering the services in the provinces and territories, be they New Democratic governments, Conservative governments, or a Liberal government, all are universally saying they're not ready. And when you have those that are the leaders in this field, like CAMH and the Canadian Mental Health Association, saying they need more time, we have to listen to that.